What is sickle cell trait and how is it diagnosed? Imagine a tiny change in your genes that can influence your health in subtle but important ways. That's what sickle cell trait is all about. It's a genetic condition where a person inherits one normal hemoglobin gene and one sickle hemoglobin gene. Unlike sickle cell disease, which happens when someone inherits two sickle hemoglobin genes, sickle cell trait usually doesn't cause symptoms or health problems. People with this trait are carriers of the sickle cell gene and can pass it on to their children. Most of the time, they live normal, healthy lives without any issues. In sickle cell trait, some of the red blood cells contain normal hemoglobin, which carries oxygen through the body, while others contain the abnormal sickle hemoglobin. This mixture doesn't usually cause the red blood cells to sickle or block blood flow, which is the main problem in sickle cell disease. However, in rare cases, under extreme conditions like severe dehydration, intense physical activity, or high altitudes, individuals with sickle cell trait might experience unusual symptoms. These can include muscle cramps, blood in the urine, or sudden pain episodes. But it's important to remember that these situations are uncommon and usually resolve quickly. Diagnosing sickle cell trait involves simple blood tests that analyze the types of hemoglobin present in the blood. The most common test is hemoglobin electrophoresis, which separates different hemoglobin types based on their electrical charge, making it easy to identify normal hemoglobin, called hemoglobin A, and sickle hemoglobin, called hemoglobin S. Another precise method is high-performance liquid chromatography, which accurately measures the amounts of each hemoglobin type. There's also a screening test called the solubility test that detects the presence of sickle hemoglobin but can't tell if it's just a trait or full-blown sickle cell disease. Many countries perform newborn screening, where babies are tested shortly after birth to identify sickle cell trait or disease early on. If a person has one sickle hemoglobin gene and one normal gene, their genotype is called as, and they are diagnosed with sickle cell trait. If someone inherits two sickle hemoglobin genes, their genotype is SS, and they have sickle cell disease. Knowing your status is especially important for family planning because if both parents have sickle cell trait, there is a 1 in 4 chance with each pregnancy that their child could inherit sickle cell disease. This is why testing is especially recommended for people of African, Mediterranean, Middle Eastern, or South Asian backgrounds, where the trait is more common. Understanding sickle cell trait helps with genetic counseling and awareness. It's a carrier state that usually doesn't interfere with daily life but can have implications for future generations. The key is that it's diagnosed through specific blood tests that detect the presence of sickle hemoglobin alongside normal hemoglobin. Remember, if you think you might be at risk or want to know your status, it's best to consult a healthcare professional who can guide you through testing options and explain what your results mean for your health and family.